Okay, hi everyone. My name is Grace Seibert, and the person I'm doing this presentation with is Alana Hendricks, and our mentor is Dr. Abigail Pierce. And for our poster presentation, our research question was, is vitamin E an effective treatment method for people with non-alcoholic fatty liver disease? And so just getting into a little bit about what non-alcoholic fatty liver disease is it's characterized as the buildup of fat on the liver that is not caused by alcohol. Most people with this disease do not experience symptoms, but over time, as the disease progresses and is not treated, scarring or cirrhosis can occur. The people who do experience symptoms of non-alcoholic fatty liver disease can experience symptoms like fatigue, abdominal swelling, or jaundice. The cause is kind of unknown right now, but risk factors for the disease can include being overweight or obese, having type 2 diabetes, or having metabolic syndrome such as insulin resistance or hypertension. And vitamin E has recently been studied as a treatment option for non-alcoholic fatty liver disease, which is why we decided our question. And so now just going into a bit of the biochemical or metabolic basis of vitamin E. Vitamin E is a powerful chain-breaking antioxidant. It has inherent antioxidative activity as it can donate a hydrogen ion from its chromanal ring to scavenge lipid peroxyl radicals. Vitamin E also increases the actions of other antioxidative enzymes such as catalase and glutathione peroxidase. Vitamin E has the ability to stop peroxidation and inhibit the expression of transforming growth factor, which can be associated with hepatic fibrosis and hepatocyte apoptosis by activating hepatic stellate cells. Vitamin E is believed to reduce alanine aminotransferase or ALT levels by inhibiting lipid peroxidation and subsequent oxidative stress in non-alcoholic fatty liver disease patients with metabolic syndrome. And so how we did our poster presentation is we did a literature review of independent studies using the UC Library database to find articles related to our research question. Articles were found using keywords such as non-alcoholic fatty liver disease, vitamin E, treatment, non-alcoholic steatohepatitis, independent studies, intervention, and clinical trials. All these searches were done in March of 2022, and we were looking for articles that had been completed within the last 5 years. And the evidence analysis library tools that were used were the EAL quality control worksheets. And so now just getting into some of the evidence that we found, we pulled out 5 key studies that we thought would be important to include in our presentation. And so the first one was done by Kim et al. It was a retrospective cohort study. It consisted of 26 patients collected through medical records at a tertiary hospital in Korea. The subjects were split into vitamin E therapy and control groups. All subjects were followed for a period of 6 months, and ALT levels were measured throughout the study, as well as metabolic profiles, such as body weight and lipid and glucose levels. And then, so the results of that study were at the end of the 6-month follow-up, the vitamin E therapy group showed significant reduction in ALT levels, reducing to 46 plus or minus 34 IUs with a significance level of 0.1, and then the metabolic profiles showed no significant change. And so our second study was a randomized, double-blind, placebo-controlled trial, and it consisted of 150 NAFLD patients who were randomly split into 5 groups and all received different treatments. We only highlighted the vitamin E treatment group for this study, but it consisted of 30 patients who received 400 IUs of vitamin D every day for 3 months. Anthropometric parameters, ALT levels, and aspartate transaminase levels were measured throughout the course of the study. And the results of that were the group receiving vitamin E supplements showed significant levels of improvement in their ALT levels. And then all groups showed significant levels in anthropometric parameters. And then this third study was a randomized control study, which consisted of 250 participants who were split into vitamin E and UCDA treatment groups. The vitamin E treatment group received 400 milligrams per day or 600 IUs for 52 weeks. And they took pre and post ALT levels, symptom levels, and NFS scores, which is fibrosis scores of non-alcoholic fatty liver disease. And so that study found that the vitamin E treatment group saw an ALT reduction of 56% and a symptom improvement rate of 78%, and a NFS improvement of 44%.
So for our fourth study here, there was a randomized single-blind study. They investigated 28 children with obesity-related hypertransamnesia and bright liver. The next thing you want to notice here is that there were 14 subjects in the oral placebo plus diet group, 14 subjects in the oral vitamin E acetate tocopherol pill, which had about 400 milligrams or 600 IUs per day, and they did that for 2 months, followed by a 100 milligram per day or a 150 IUs per day for 3 months, plus the diet. When the results came out, they saw a statistically significant difference between the groups 1 and 2 in the vitamin E and cholesterol ratios. And at 2 to 5 months, they also saw a bigger difference there. And they also saw a decrease in the ALT levels. Finally, for our fifth study, it was a randomized double-blind control trial. They investigated 105 patients with type 2 diabetes and NASH, which is your non-alcoholic steatotic hypo. And they were separated into one of 3 groups. There was the placebo group, the vitamin E alone group, or there was the vitamin E with the pioglitazone group. The first group was presented with 400 IUs of vitamin E, just the vitamin E. Group 2 had the vitamin E same amount, 400 IU, but they also added the pioglitazone, which was about 30 milligrams per day, and then the third group had the placebo of both. As a result, the resolution of NASH occurred in 42% of the vitamin E only group, 18% in the placebo group, and 57% in the combination group, which had a significant level of 0.001. Our limitations show here on most of the articles that it was a lot of short-term effects of vitamin E that were assessed. So if they did do the study for a little bit longer, maybe they would see some different results. Other treatment options were shown to be equally as effective in the reduction of ALT, so not just the vitamin E, but also a combination. The liver biopsy can have high costs and complications, so they did want to reduce those amounts as much as possible, but with the methods that they wanted to collect, they had to do these types of just biopsies that have a lot of high cost to those. Finally, the last limitation, all studies reported to have very small sample sizes, and obviously a bigger sample size would give you better more effective results. And as a summary, vitamin E in general can decrease the amount of ALT for patients with NAFLD or the NASH diet or the NASH. Supplementation of vitamin E had also shown to improve symptoms related to NAFLD. And participants in the vitamin E supplementation also saw a lot of improvements in their anthropometric parameters like losing weight and other stuff. In conclusion, vitamin E supplementation is going to be able, again, to decrease NAFLD and NASH. The total amount per day that was shown in all three studies was about 400 to 600 IUs per day, and that was giving improvements in the symptoms of the disease. There's a noticeable importance of a 5 to 10% weight reduction to decrease hepatic inflammation. So that's why we want to also make sure they are exercising on top of this and this supplementation. Thank you so much. And those are our references at the end there.